Hi, my name is Rahim. I'm from Kenya. On my right we have Nayara, and on my left we have Caeel. So Caeel was diagnosed with Beta Thalassemia Major when he was 2 years old, and his long-term treatment was an allogeneic BMT. It was supposed to happen for his treatment basically. We were being seen by doctors in Kenya for about 1.5 to 2 years before we were referred to HCG in Kenya by one of the doctors that we were seeing in Kenya. We've had multiple discussions and engagements with HCG in Kenya through the team with Vishnu and Dennis. And we also got the opportunity to meet with Dr Intezar when he was down in Kenya for a couple of meetings that he was attending there. So we did get the opportunity and were privileged to meet him there prior to traveling to Bangalore.
Caeel Rahim, he came to us from Nairobi, Kenya. Actually, the first interaction I had with the child and the family was when I went to Kenya for a couple of meetings. I met the family there. So he was a young boy, about 5 years old, and he was diagnosed to have this beta thalassemia right from a young age, and he was getting regular transfusion and few medicines to bring down his ferritin level called as chelation therapy. So thalassemia is a blood disorder which what happens is like these children are not able to maintain their hemoglobin because there is a defective hemoglobin synthesis in their body. So they have to be on regular transfusion. Most of them require transfusion once in 3 to 4 weeks, and after about a year or two their ferritin becomes high and they need to be on medicines to bring down the ferritin level. Otherwise, over a period of time, this iron actually gets deposited in some of the vital organs of the body like liver and heart, and it causes a lot of issues related to growth, puberty, endocrine dysfunction, and by the time they are in second and third decade they can develop life-threatening complications, and their lifespan is shortened because of one of these complications.
What I'd like to say about HCG, first of all, HCG in Kenya, it's a really good facility. They did take their time to speak to us, to address our concerns. They did also give us an introduction with the HCG team in Bangalore. So initially our engagement with HCG in Bangalore was online, was basically virtual, whereby we had the team, Saqib, Satish, Rafiq brother, actually give us a virtual tour of the facility, not only the outpatient facilities, but also the BMT facilities, just to give us some level of comfort, as far as our concerns were. When we did come to HCG, we actually had a very interesting engagement with the faculty at HCG. They were very accommodating from the time we landed in Bangalore to the time we had our first visit in the HCG facility here and consequent visits.
So potentially at present the only curative option for beta thalassemia major is allogeneic bone marrow transplant, wherein we have to take the stem cells from a donor who is not affected by this problem, and then we actually do the transplant to cure. So in Caeel's case, fortunately, his sister, who is a year younger than him, Nayara, she was fully matched on the HLA typing high resolution. So we were able to perform the transplant. So we had this discussion with the family there in Nairobi that we can do the transplant taking Nayara as the donor. The family came to us. We did a pre-transplant evaluation for Caeel. We found out that his ferritin was slightly on the higher side, and there was some iron deposition in the liver causing about moderate to severe iron overload in the liver and heart. So we put them on some medications, aggressive chelation therapy to bring down the ferritin, that is the iron deposition from the heart and liver, and we put him on some immunosuppression medicines before the transplant. Subsequently, we collected the stem cells from Nayara, and then we put Caeel in the bone marrow transplant unit, and we give some medications called as conditioning chemotherapy, basically to create space for the healthy marrow. And once that is done, then we infuse the stem cells from the donor. And during the bone marrow transplant phase, that means after we have given the conditioning chemotherapy and the stem cell infusion, about 2 to 3 weeks is the critical time where children develop fever, low blood counts, mucositis, vomiting, diarrhea, and they require a lot of blood and platelet support and antibiotics, risk of bacterial fungal infection, sometimes viral. So he had few complications during the transplant, and then by God's grace, about a month later, he came out of the BMT unit, and we did the chimerism test for him, and by God's grace, his chimerism showed full donor chimerism. That means now his bone marrow, his faulty bone marrow, is replaced by the healthy marrow of his sister. Now it's about 4 months, close to 4 months post-transplant. They were here for the first 3 months post-transplant for follow-up with us, and we had to titrate his immunosuppression so that he doesn't reject the graft, and monitor for viral infection and other infections, and titrate the level of immunosuppression. By God's grace, he has had a smooth post-transplant period, and now he is all set to go back to his home country, Nairobi, Kenya, and the family is extremely happy and delighted. He will have to be on immunosuppression medicines for few more months and prophylactic medicines. We have put him across to one of the pediatric hematologists and BMT consultants there in Nairobi to look after him, and the family is extremely happy, and so are we. We have been able to help this child and the family to get a cure from thalassemia major, and we hope and pray that this child continues to do well in the future.
The entire faculty here at HCG in Bangalore have been very supportive, very accommodating. If I were to name everyone, the list goes on and on, but from the support staff to the cleaning staff to the international staff, Saqib, we have Satesh, we have Rafiq brother who have been very kind to us. We have had Sister Shilpa and the rest of the sisters in the hospital. The doctors have been great, Dr Intezar, Dr Summa, Dr Smita and Dr Amit have all been very supportive and very caring of Caeel. They have been very patient with us, as parents we have been extremely worried about Caeel's condition, and they have been very patient with us during the entire process. They guided us on what needed to be done, they guided us on the procedures and so on and so forth. We have been in Bangalore for about 6 months, so Bangalore has been a home away from home, in as much as that we are very excited to going back to Kenya. We are a bit concerned regarding the follow-up care back home, but the doctors have assured us that everything will be well, and our doctors back in Kenya will be in close contact with the faculty here in Bangalore to ensure that everything goes well. In fact, a couple of our friends back home who have similar cases, disorders, sicknesses within their families have asked us about our experience in HCG, and we had very positive things to say. So I'm quite confident that when we do go back home, they will definitely ask us a bit more and get in touch with HCG as well. So on behalf of Caeel and Nayara, and of course my wife who's unable to be with us here today, would like to thank the entire HCG family for everything that they've done for us, isn't it? What do you say?
Thank you.
And you?
Thank you.
Bye.
Bye.